these data points, especially now when many of our schools are reopening either in person, virtually, or in a hybrid model. I get a lot of questions about whether schools should be opening now because we have more cases than when our schools were shut down in March. We shut things down in March to prevent a surge that would overwhelm our healthcare system. That allowed us to build the infrastructure for testing and secure the needed ICU beds, vents, and PPE to ensure our hospitals could manage the outbreak for the long term. We were successful in those efforts, so the conversation now about schools reopening is really quite different. I continue to believe that our schools can safely reopen by wearing masks, practicing social distancing and good hand washing, cohorting students, and ensuring that people who are sick or are close contacts of someone with COVID stay home. This does not mean that our schools will be free of COVID. What it means is that we all need to do everything possible to limit the spread of COVID. I cannot stress enough how important it is to stay home if you're sick. If you have symptoms and you're waiting to get the results of your COVID test, stay home. If you're a close contact of a person who's tested positive and don't have symptoms, stay home for the full 14 days of your quarantine. And parents, please make sure that you're screening your children every day before they go to school. We're counting on you to help. We've also had cases in schools where students and staff have had to be quarantined because a symptomatic individual came to school, or even an individual who knew they were supposed to be quarantined came to school and then became ill. The best way to prevent this is for everyone to do their part and know when to stay home. I know that teachers, administrators, and parents across the state are searching for that one single metric or number we can use to guide us as to when it's okay to open schools and when schools would need to close down. There simply is no single benchmark that accurately represents the level of community spread for every county in our state. The 7-day positivity rate is certainly one metric to look at as we help guide superintendents and public health officials in each county as they make decisions for schools. But that cannot be the only metric that is considered. For example, a high percent positivity could be due to cases in a long-term care facility. Counties with a high number of cases related to outbreaks in congregate living settings or industries are different than counties that have a wide spread of numbers of cases randomly throughout their community. Other counties may show high positivity rates based on the low number of testing that occurred during that period of time in their county. So also looking at the number of tests per 100,000 individuals is important. Just like in our Back to Track plan, when we assessed 4 different metrics, it's important to look at the whole picture for a county. These are some of the factors we will examine as we help school and local officials as they make decisions. Other factors that we study on a community level are changes in that 7-day positivity rate, the number of tests per 100,000 individuals, the sources of the outbreaks, emergency department visits for influenza-like symptoms or illnesses, and emergency room visits and hospitalizations. I also have been asked how many cases of COVID in a school would cause that school to close. Again, that depends on whether those cases are localized to one classroom because the school has done a great job of cohorting those students, or whether those cases are spread throughout the school in different grades and different classrooms. These are decisions that are made with your local public health department and your school officials. We are here to help them understand the complete picture of what's happening in their community. We're also getting questions about how we will know whether a positive case is linked to a school and whether we'll be posting that data. Our contact tracers will ask each positive case if they attend a school. This will help ensure that schools and local health departments are informed so that they can move quickly to quarantine anyone who is a close contact. I would say that there's personal responsibility here, and that I hope that every school has asked every family, every parent, every student to report immediately when they get that positive test result to their school. We've seen this work very well in several districts this week when cases were identified in a student or a staff member. We understand that there's a lot of interest in knowing about positive cases in schools, but there are a number of issues at play that we are considering as we think about this. First, many of these cases will involve minors, which requires us to look carefully at what data can be shared and how. Secondly, unlike long-term care, we have to navigate both HIPAA and FERPA privacy rules. I want to emphasize that having a case of COVID in a school should not be a cause for panic or a reason to close. It's a reason to take action to prevent an outbreak. And we've been working with schools and local health departments to ensure they have the tools to do that. We've developed a number of back-to-school resources on our website at coronavirus.in.gov. We've created a hotline for school administrators, which we shared with them today. We hired a school nurse liaison who has been hosting weekly webinars for school nurses and administrators to answer their questions. And we're also finalizing a toolkit for schools to provide easily accessible resources, such as symptom checkers, contact tracing checklists, and guidance on quarantine and isolation. We will continue to develop guidance to help our schools through this unprecedented time so that students and teachers can have the best and safest learning experience possible.